I remember sitting across from a 72-year-old woman who looked at me and whispered, "I think I'm fading." She said it quietly, like it was a secret she did not want her family to hear. She told me she moved a little slower. She cared less about small arguments. She preferred silence some days, and she thought those changes meant she was declining. But as she spoke, I saw something different happening right in front of me. Her mind was sharper than she realized. Her reactions were calmer. Her priorities were clearer. What she thought was fading was actually refinement. When you pass 70, subtle shifts begin inside you. Your body conserves energy differently. Your brain filters noise more efficiently. Your emotions respond with more control. But nobody explains that part. We're trained to look for disease, weakness, and warning signs. So every new sensation feels like a threat. Every slower movement feels like loss. The truth is, some of these changes are protective. They are the result of decades of adaptation. They are signs that your system is choosing wisdom over impulse. Pills cannot create this. Supplements cannot manufacture it. And no trendy routine can force it. These are internal adjustments that happen when a body has survived storms, stress, heartbreak, and recovery. The problem is that most seniors mistake them for problems instead of progress. In this video, we will reveal 5 changes that quietly appear after 70, ranked from least powerful to most powerful, so you can recognize whether you are actually aging well. And wait until you hear number 3. Most people fear it when it first shows up, but in reality, it may be one of the strongest indicators that your mind and body are working exactly as they should. I place the supporting insights and research down below in case you want to see where this understanding comes from. Before we dive in, here's a quick question. How old are you right now, and have you noticed yourself reacting differently to stress than you did 20 years ago? I read your thoughts carefully because your experience matters deeply to me. Now, let's begin with number 5, the first quiet change that often gets misunderstood, but tells a powerful story about how well you are aging. Number 5, your voice gets deeper and changes tone. This is one of those changes that catches almost every woman completely off guard because nobody ever warns you it is coming, and when it happens, most women assume something is wrong with their throat or their lungs when the real explanation is far more fascinating. After 70, most women experience a noticeable drop in vocal pitch, meaning your voice literally gets deeper and lower than it has been your entire adult life. Research published in the Journal of Voice found that the average one's fundamental speaking frequency drops by approximately 10 to 15 hertz after menopause, and this drop continues gradually through the 70s and beyond. What is causing this is genuinely strange. Throughout your reproductive years, estrogen kept your vocal cords thin, flexible, and taut, which is what gave your voice its higher pitch and clarity. But as estrogen levels decline dramatically after menopause and continue falling through your 60s and 70s, your vocal cords actually thicken, stiffen, and lose some of their elasticity, which makes them vibrate at a lower frequency and produces a deeper, sometimes huskier tone. At the same time, the small muscles in your larynx that control voice production begin to atrophy slightly, and the cartilage structures surrounding your voice box gradually calcify and harden, which further changes the resonance and quality of your sound. Some women notice their voice becomes raspier, some notice they cannot hit the high notes they used to when singing, and some simply feel like their voice sounds unfamiliar when they hear recordings of themselves. Here's the important part. While this change itself is completely normal and not dangerous, the rate and severity of vocal change can actually tell doctors a lot about your overall hormonal health and even your bone density, because the same estrogen loss driving your voice change is also affecting your skeleton, your cardiovascular system, and your brain simultaneously. Women who experience extremely rapid or dramatic voice changes should mention it to their doctor because in some cases it can signal thyroid dysfunction, acid reflux damage to the vocal cords, or even vocal cord lesions that need attention. But for most women, a gradually deepening voice after 70 is simply your body adapting to its new hormonal landscape, and many speech-language pathologists actually recommend vocal exercises like humming, reading aloud for 10 minutes daily, and staying well hydrated to keep your vocal cords flexible and your voice strong and clear. Drinking plenty of water is especially important because aging vocal cords dry out faster and dehydrated cords vibrate poorly, leading to that thin, weak sound that many older women unnecessarily accept as inevitable when it is actually very fixable. This voice change is strange enough, but the next one is even more unexpected. Before we go any deeper, tap like and subscribe so you don't miss the game-changing advice coming up. Number 4, your body starts growing new hair in strange places. This is the change that almost every woman over 70 knows about personally, but very few people talk about openly because it feels embarrassing. And the science behind it is actually far more interesting and important than most women realize. After 70, many women notice coarse dark hairs appearing on their chin, upper lip, jawline, and sometimes even their cheeks and neck in places where they never had visible hair before. At the same time, and somewhat paradoxically, the hair on their head continues to thin and the hair on their arms and legs often becomes finer and sparser. This seemingly contradictory pattern drives women crazy because it feels like their body is doing the exact opposite of what it should. But when you understand the hormonal science behind it, it actually makes perfect logical sense. Throughout your adult life, estrogen and testosterone existed in a careful balance inside your body, and even though testosterone is thought of as a male hormone, women produce it too in smaller amounts from their ovaries and adrenal glands. When estrogen levels plummet after menopause and continue declining through the 70s, the relative proportion of testosterone in your body increases significantly, even though the actual amount of testosterone is also slowly decreasing. This shift in the ratio is what matters. The hair follicles on your face, particularly around the chin and jawline, are extremely sensitive to androgens like testosterone, and when the estrogen that was previously keeping those follicles dormant disappears, even small amounts of circulating testosterone can activate them and trigger the growth of thick, coarse terminal hairs, where only fine invisible vellus hairs existed before. Meanwhile, the hair follicles on your scalp respond to this same hormonal shift in the opposite direction, becoming more sensitive to a testosterone byproduct called DHT, which causes them to miniaturize and produce thinner, weaker strands over time. This is why so many women experience the frustrating combination of facial hair growth and scalp hair thinning simultaneously after 70. Understanding this hormonal mechanism matters beyond just cosmetic concerns because the degree of androgenic change in your body can actually provide important health signals. Women experiencing extremely rapid or excessive facial hair growth should have their hormone levels checked because in some cases it can indicate adrenal gland dysfunction, ovarian abnormalities that persist even after menopause, or medication side effects. For most women, though, managing this change is straightforward. Dermatologists recommend gentle removal methods like threading or small electric trimmers rather than waxing or harsh chemicals on aging facial skin, which becomes thinner and more fragile after 70. Some women also benefit from topical treatments prescribed by their dermatologists that can slow unwanted facial hair growth while supporting scalp hair health at the same time. That change affects what you see in the mirror, but the next one is happening deep inside your body. Number 3. Your bones are silently reshaping themselves. This is probably the most bizarre change on this entire list because it sounds like something out of a science fiction movie, but it is absolutely real and documented in medical literature, and understanding it could literally save your life. After 70, a woman's skeleton does not just lose density the way everyone talks about with osteoporosis. It actually changes shape. Research published in the Journal of Bone and Mineral Research using advanced imaging technology found that as women age past 70, the outer diameter of their long bones, particularly in the legs and arms, actually expands and increases in circumference even as the inner bone becomes more porous and less dense. Your body is essentially trying to compensate for weakening bone quality by making the bones geometrically wider, because a wider tube is structurally stronger than a narrow one even if the walls are thinner. Orthopedic researchers call this periosteal expansion, and it is your skeleton's remarkable attempt to maintain its load-bearing capacity despite the mineral loss caused by decades of declining estrogen. But here is where it gets even stranger for women specifically. The same bone reshaping process also affects the skull and facial bones, and this is actually one of the hidden reasons why women's facial appearance changes so dramatically after 70 beyond just skin aging. Studies from the American Society of Plastic Surgeons found that the eye sockets enlarge, the angle of the jawbone decreases, and the bones supporting the midface actually recede and flatten, which contributes to that sunken appearance around the eyes and cheeks that many women notice. This is not just skin sagging. The actual foundation underneath your face is physically restructuring itself. Understanding this matters immensely for practical health reasons because the type of bone reshaping your body does depends heavily on the mechanical forces you put on your skeleton through physical activity. Women who remain physically active after 70, particularly those who do weight-bearing exercises like walking, dancing, climbing stairs, and light resistance training, stimulate their bones to reshape in stronger, more functional patterns compared to sedentary women whose bones reshape in weaker configurations. The National Osteoporosis Foundation specifically recommends that women over 70 get at least 30 minutes of weight-bearing activity most days of the week, combined with adequate calcium intake of 1,200 milligrams daily and vitamin D supplementation of 800 to 1,000 international units to support this natural remodeling process. Balance exercises are equally important because the single biggest danger from bone changes after 70 is not the bone loss itself, but the falls that exploit weakened areas, and women who train their balance regularly reduce their fracture risk by up to 40%. Your bones are reshaping without your knowledge, but the next change is something you can actually feel. Number 2, your pain perception actually shifts and changes. This change is genuinely one of the strangest things that happens to women after 70, and it has confused researchers for years because the findings seem almost contradictory until you understand what is really going on inside the aging nervous system. Multiple large studies, including research published in the journal Pain and findings from the National Institute on Aging, have confirmed that as women age past 70, their sensitivity to acute sharp pain, like a pinprick or a sudden burn, actually decreases measurably compared to younger women. Your ability to detect quick painful stimuli becomes dulled, meaning you might not notice a small cut, a minor burn while cooking, or a developing pressure sore as quickly as you would have at 50. However, and this is the truly strange part, your sensitivity to chronic deep aching pain simultaneously increases, meaning conditions like arthritis, muscle soreness, and nerve pain can feel more intense and more persistent than they would have earlier in life. Researchers believe this paradoxical shift happens because two different pain processing systems in your body age at different rates. The fast-conducting nerve fibers called delta fibers that carry sharp immediate pain signals deteriorate more quickly with age, while the slower C fibers that carry dull throbbing chronic pain signals remain relatively intact or even become more sensitized due to changes in how your spinal cord and brain process incoming pain information. A fascinating study from the University of Florida found that women specifically experienced this divergence more dramatically than men, likely because estrogen played a significant modulatory role in pain processing throughout their lives, and its absence after menopause gradually alters the entire pain signaling landscape in ways that are still being fully mapped by researchers. This matters enormously for practical health and safety reasons that every woman over 70 needs to understand. The decreased sensitivity to acute pain means you need to be more vigilant about checking your body for injuries you might not feel, particularly on your feet and lower legs where circulation is already reduced with age. Diabetic women are especially vulnerable because neuropathy, combined with this natural dulling of acute pain sensation, can allow serious foot wounds to develop without any warning pain whatsoever. At the same time, the increased chronic pain sensitivity means that conditions like osteoarthritis may feel disproportionately worse than the actual joint damage would suggest on an X-ray, and understanding this can help you and your doctor choose more appropriate and effective pain management strategies rather than assuming the pain means catastrophic structural damage. Regular gentle movement like swimming, tai chi, and walking has been shown in clinical trials to help recalibrate both pain systems by maintaining nerve fiber health and promoting the release of natural endorphins that modulate pain perception from both directions simultaneously. Everything on this list has been strange, but the number one change might be the most important thing you hear all year. Number 1, your brain secretly reorganizes how it thinks. This is the most extraordinary change that happens to women after 70, and the science behind it has completely transformed what neuroscientists believed was possible for the aging female brain. For decades, the medical establishment operated under the assumption that the brain only declines after 70, losing neurons, shrinking in volume, and slowly becoming less capable with each passing year. But groundbreaking research using functional MRI technology has revealed something that stunned the neuroscience community. The brains of healthy women over 70 do not just decline. They actively reorganize and compensate in ways that are remarkably different from men's brains, and in many cases produce cognitive advantages that younger brains simply do not possess. A landmark 20-year study published in JAMA Neurology that followed thousands of older women found that female brains after 70 increasingly recruit both hemispheres simultaneously to perform tasks that younger brains handle with just one side. This bilateral activation pattern, which researchers call the HARLD model, meaning hemispheric asymmetry reduction in older adults, was significantly more pronounced in women than in men, and the women who showed the strongest bilateral activation pattern had a 44% lower risk of all-cause mortality and performed better on tests of complex reasoning, emotional intelligence, and real-world decision-making than women whose brains did not make this shift. What is happening is that your brain is essentially calling in reinforcements from the opposite hemisphere to compensate for any age-related processing slowdowns, and it does this automatically without any conscious effort on your part. Women appear to be better at this reorganization than men, partly because the female brain has a naturally larger corpus callosum, the thick bundle of nerve fibers connecting the two hemispheres, which provides more bandwidth for cross-hemisphere communication, even as other structures are gradually aging. This reorganization also explains why many women in their 70s and 80s report feeling like they think differently rather than worse. They process information more holistically, draw on broader life experience more fluidly, and often arrive at better real-world solutions to complex problems than they did when they were younger, even though they might be slightly slower at processing speed or rote memorization. To support and strengthen this remarkable neural reorganization, the most important thing women can do is keep exposing their brains to novel and challenging experiences. Learning new skills, engaging in creative activities like painting or writing or music, solving complex puzzles, having substantive conversations about unfamiliar topics, and even traveling to new places all force your brain to activate these bilateral pathways more frequently and keep them strong. Physical exercise is equally critical because cardiovascular activity directly increases blood flow to the brain and promotes the growth of new blood vessels that supply the oxygen and glucose your reorganizing brain demands. Staying socially engaged matters tremendously too, because conversation and social interaction activate more brain regions simultaneously than almost any other daily activity, making social connection essentially a full brain workout every single time you do it. So there you have it. 5 genuinely strange and fascinating changes that happen to women's bodies after 70, from your voice dropping in pitch to your body growing hair in unexpected places, from your skeleton quietly reshaping itself to your pain perception shifting in paradoxical ways, and most remarkably of all, your brain secretly reorganizing itself into a more powerful bilateral processing machine that can actually outperform younger brains on complex real-world tasks. These changes are not signs that something is going wrong. They are signs that your body is adapting, compensating, and doing everything in its biological power to keep you functioning, protected, and alive. The women who understand these changes and work with their bodies instead of against them are the ones who thrive the longest and live the fullest. If this video opened your eyes to something you did not know about your own body, please hit that subscribe button and turn on notifications so you never miss another video like this one. Thank you so much for watching.